But first tonight, the frightening side effects of antidepressants in children. More than 50,000 kids take depression or anxiety drugs, some as young as 5. And as Lucy Polkinghorne reports, there's a dark side many parents aren't aware of.
I want to die!
He got worse. He just got worse, and it did not occur to me at all that the medication had anything to do with it.
I want to die!
This is what 5 years on antidepressants has done to a little boy, 10-year-old Seth.
He got a pair of scissors from the kitchen drawer and held them to his heart and said that he was going to do it.
How often do you see this side?
Every day, every day.
I got a bird, finally.
Before this, Seth was an anxious but otherwise happy child.
Not wanting to eat in front of people, so the anxiety was definitely there.
Seth was 5 when Mum Donna was recommended the antidepressant Aropax, also known as paroxetine, by their family GP.
She didn't actually see him to diagnose anything.
She just wrote a script?
Yep.
The GP also failed to advise of any possible side effects. At first, the drug appeared to help with Seth's anxiety, but after a week, he turned aggressive, angry and violent.
He would hit his head with his hands. He would hit me.
For 5 years, Donna and Seth have battled days like this and worse. Believing the medication wasn't strong enough, Seth's paediatrician increased his dose.
There were 3 emergency service calls to the school this year.
How bad did it get?
The saying of the day became, "Why did you have me? I don't want to be here anymore."
Seth hasn't been to school for 2 months and has been in and out of hospital. He has seen behavioural therapists, developmental paediatricians and countless psychologists. Yet no one questioned the antidepressant. It was Donna who discovered the devastating effects
I want to die!
they were having on her son.
He's my little boy, and I'm meant to take care of him. I trusted the doctors. The doctors trusted the pharmaceutical companies.
Well, they haven't got the metabolism for antidepressant medication. Their metabolizing enzymes are not mature till they're 25.
Forensic psychiatrist Dr. Yolanda Lucia has been fighting the prescribing of antidepressants to children since the 90s.
None of them has been approved for children except paroxetine for major depressive disorder, which is rare. To be approved, the drug has to beat a sugar pill in 2 clinical trials, and they can do 1,000. It's known as legal fraud.
He just said it'll work, it'll be fine. This is just a part of it, her adjusting to the medication.
Mel's daughter Maya was prescribed the antidepressant Zoloft when she was 5 for anxiety. She too experienced the worst side effects.
If he had said to me any of those side effects of, depression, aggression, suicide or suicidal thoughts, any of those would have been brought up in that conversation at that day in that surgery, there's no way in the world that I would have put my child on this.
Is it safe for kids to be prescribed antidepressants?
Absolutely not. The worst and most dangerous side effect is called akathisia, which is a can't-sit-down restlessness associated with thoughts of violence, which turned in on oneself become suicide, or turned out become homicide, even mass homicide.
Akathisia is commonly mistaken for psychosis, but there is a big difference.
These are substance and medication-induced disorders, which are toxic states. They're toxic states like being drunk is a toxic state. If you take away the drug, they get better.
While the UK has banned the use of antidepressants for persons under 18, Australia is yet to catch on. Rhea is off the drug and is a different person. Seth is being weaned off Arapax under professional supervision.
I'm so glad that we know now.
Speaking out about this hopefully will change someone else's, life.